Coming up today, mammograms save lives. But what are they really like? We follow one woman going through her first ever breast exam. Good morning, everyone. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we are kicking off Pink Week, featuring episodes devoted to breast cancer, from detection to treatment to remission. And we start with simply the most important, screening. Millions of women get mammograms every year, but only a few are brave enough to let a camera come along. And the woman you're about to meet will join us. We're going to join her during her very first ever breast exam.
I'm Megan Peters, and I am at the Indian Creek campus of the University of Kansas Health System to get my first mammogram. I just changed into my lovely robe, and I am feeling a little nervous. I've had some friends tell me that this is not necessarily a pleasant experience, but I'm ready to get it over with and get it off my to-do list. And I'm waiting for the nurse to take me back to the exam room.
Mary Beth, my coworker.
Hi, Mary Beth.
How are you?
I'm all right.
And I just want to go over a few things. Lean into the machine here. Good. Bend your elbow for me. Okay.
That was like not that bad. I don't understand why everybody's freaking out about that, but maybe I just haven't gotten to the hard part yet.
For your right shoulder for me. Okay.
Not that bad. I honestly was expecting it to be a lot more painful. It definitely was not pleasant, but it wasn't painful at all, and Emily made it so easy. She really positioned me, and I just kind of had to let her do the movements and in and out pretty quickly.
All right, we are all finished.
Okay,
you did
thank
awesome.
you.
We're gonna head to the right here.
Okay. So now it feels like the hard part is over, but now I have to wait for my results. Emily, my nurse, told me I should be getting my results later today via MyChart, which is so great because I didn't really think past getting the actual mammogram and the nervousness that might kind of come in afterwards waiting for the results. So being able to know fairly quickly is such a wonderful gift, and I'm excited to get those results later today. Hopefully they will be all good.
And Megan Peters is with us now this morning, as well as Dr. Annalisa Winblad, a radiologist and fellowship-trained breast image specialist and the division director of breast imaging at the University of Kansas Cancer Center. Ladies, good morning, and thank you for being here, kicking off Pink Week, such an important month, right?
Yes, thank you for having me.
Well, Megan, first, just thank you for sharing the first ever mammogram experience. What prompted you to get the mammogram? Was it just your age?
It was a combination. I had turned 40. My father had passed away from cancer the year prior. And then it turned out several of my friends started getting diagnosed with breast cancer, and they were around my age. And it was almost like a click in my head of, wait a minute, all these people my age are getting diagnosed. Do I need to get screened? And then when I saw the guidelines, and at that time, I believe the cancer center here was screening at 40, but the national guidelines hadn't quite been pushed to 40 yet. They were at 45 when I scheduled the appointment, and then it turned out the week that I scheduled the appointment, the national guidelines got bumped as well. So I felt like I was ahead of the game.
You were right there. And it's interesting, as we get older, you think of 40, so far off. When
older
you're in your 20s.
people are getting, and then I was like, wait,
right.
that is me.
That is me. So
Yeah.
what surprised you most about the experience overall? Not just maybe even the actual exam, but just entering in and going through it. What were you feeling?
I was feeling a little bit nervous, I think, as everyone does. I actually think the fact that we filmed it made it a little less nerve-wracking because everybody was like, oh, there's a camera behind her. But I think that it was the warmth of the space and the warmth of everyone in it. I mean, every patient in the waiting room because I had a camera with me, I was like, oh, what are you doing? I'm having my first mammogram. And they were all so lovely. It's not that bad. Some people might have told you it's going to be hard. It's not going to be hard. And it was just a pretty positive experience.
It's like you enter in this waiting room / sisterhood.
Yeah, very much. Everybody with our matching wraps on, sitting in the waiting room.
Kind of like a spa day, but not quite.
Kind of. And
Right.
some of the other ladies were telling me, about their first mammogram experience and how things have changed. So that was really interesting to hear.
That is really interesting. What were they saying about their first?
They were saying different things, like the different kinds of mammograms that were available when they were first getting mammograms, that it did used to be more painful. That was the number one thing I think I was worried about, other than, of course, having a positive diagnosis at the end. But at the day of, it was, oh, is this going to be so uncomfortable and painful?
Let's talk about exactly what it felt like.
Yeah.
Cold, painful, uncomfortable.
I have 2 kids. This was not painful. It wasn't comfortable, but it wasn't painful. I will say that I know for some women it can be, and that was another thing I learned, that kind of depending on how you're kind of set up, it could be a little bit more painful or a little bit less. I found it to be 0 pain, a little bit of discomfort, and of course a little bit of just nervousness. You're nervous getting in there, so I think some of that kind of makes you stiff.
But thanks for bringing it back to childbirth.
Yeah.
We kind of compare all pain thresholds to
Yeah.
that, right?
Yeah.
So you talked about results. How long did it take you to get them? And maybe just walk us through what they were.
Sure. So my results, thankfully, were clear. I did have dense breasts, which I knew that was a possibility. My mom has that. My sister has that. But nothing to be worried about. And I actually had my results by noon that day on my chart. And then I think 2 days later on paper, I had them.
So Dr. Wimblad, what kind of comments do you hear from patients who might hesitate to get the mammogram, which is why we're doing the show, to actually show someone going through the process and here to say it's not so bad?
Some patients hesitate to get a mammogram because they're concerned about the possibility of pain or discomfort. And as you said, some patients are just worried about the possibility of a cancer diagnosis. But most patients that have had their first mammogram share the same review, that it was much faster and much easier than they anticipated. Breast cancer screening is important, and most patients that have had a mammogram strongly advocate for screening mammography.
Megan mentioned running into women who, had breast imaging from back in the day. Tell us how it's evolved.
Well, I think, technologists are going to get you through the exam. They make it very comfortable. They are well trained in positioning. Our paddles that we use are probably a little bit more, gentle and things than, and past times. But in general, I think most people get through the exam really well, really fast. Our equipment is, advanced, and our goal is to get patients the same experience that you've had, where they, that it was a pleasant overall experience. Of course, no one wants to have a screening mammogram, but we want patients to come back and have that important screening test.
But I bet you felt good when you walked out.
Oh, I felt great. And one thing I didn't say that was so helpful was the technicians and the nurses. Emily, who was mine, and she was so kind and just walked me through every single step before we even got in there. There was nothing that was surprising, just kept talking to me. And it's, it's one of those things where you do one side, and then by the other side, I was like, oh, I know how to do this, Emily. You don't need to tell me where to put my arm. But just having her there and just talking me through it was so helpful.
So, difference between a 2D and a 3D mammogram?
So 3D mammograms are the most advanced, the newest mammogram technology we have available. 3D mammograms allow a radiologist such as myself to find more cancers on a mammogram, and they also help reduce the number of patients that need to return for additional imaging after a screening mammogram. We're fortunate at KU, all of screening mammograms are performed with this superior 3D technology.
And sometimes a mammogram isn't enough. I know I've had to go back and have an ultrasound. What other testing might be done, and why is it important, and who might be up for that?
You're correct. Some patients need not only a screening mammogram, but an additional breast screening test. So this is true for our patients who are high risk for breast cancer, such as our patients with a genetic predisposition for breast cancer, our patients with a strong family history of breast or ovarian cancer, our patients who've had a history of chest radiation at a young age, amongst others. So for our patients who are high risk, we recommend they have breast MRI every year in addition to a screening mammogram.
So what questions, if any, should we be asking the technician? Is there anything, or do you just walk in and smile and here we go? Or is there anything you should be asking as you're in there?
The technologist is going to get you through the exam quickly and hopefully as comfortably as possible. But do alert the technologist if something is bothering you. You know, if you've had a neck or shoulder surgery and something's bothering you, make sure to alert the technologist so they can tend to your needs. Ask how you will receive your results. At KU, our patients receive their results on MyChart immediately once the radiologist has signed the report and letters are mailed. And make sure to alert our technologist if you've had external mammograms at another facility. The accuracy of your results will be improved if the radiologist has your comparison mammograms available at the time of interpretation. So let us know if you have external mammograms and we will do the work of obtaining those for you.
How are you able to get these done so quickly? Because I remember that's such a relief. You walk out and then boom, it's in your MyChart and you're like in the clear. How are you able to get those done so quickly?
So digital mammogram images go directly from the mammogram unit where the images are taken to the radiologist workstation. Where they can be viewed and interpreted almost immediately. So typically there's little delay in the ability to read the mammogram and provide results. However, if there is a delay, it's likely because we have requested external comparison mammograms.
I want to talk about dense breasts, and we actually have an entire show dedicated to it, and you're going to be sitting with us and talking more about that. But what should women know about dense breasts? Let's touch on that.
So patients will be notified if they have dense breast tissue. So patient notification is required now and will be required by federal mandate in September 2024. At KU, we notify patients if they have dense breast tissue.
Why is that?
It's because patients with dense breast tissue have a slightly higher risk of breast cancer, but they also have breast cancers that are harder and sometimes impossible to find on mammogram. So for patients with dense breast tissue, we do offer them additional breast cancer screening tests. They can choose to have breast MRI, contrast enhanced mammography, or ultrasound exams.
Okay, so I just want to tell you about an experience I had over the weekend. My best friend called and said she found a lump. So it was a little shocking. And so I said I'm going to be calling you every hour on the hour, all day on Monday. As soon as I get off the show, I'm going to be calling her to say, did you get in? Did you get in? Of course, she told me not to worry, but and her husband, who happens to be a physician, said, you know, it's deep, but it could be something else. So she was trying to put my fears to rest, I'm sure as a lot of women do, try to put other people at ease. But what else could it be? For a woman who might be doing a self-breast exam or find something, what else could a lump be or mean?
So most lumps are actually not breast cancer. So that's the good news. Most lumps end up being benign findings such as cysts in the breast or benign masses. You know, fibroadenoma is a common benign mass in the breast. However, if something changes or a patient feels a new lump, it's incredibly important to still be seen and have imaging so we can assess what the lump is due to. Because we don't want to miss a breast cancer. As you said, breast cancer is really common. We all know someone with breast cancer. We don't want it to be missed. So if someone has a new symptom, it's most likely will be benign. However, we don't want to miss anything, so come and get imaged.
So don't make a leap to cancer, but definitely get it checked out.
Exactly.
Got it. Okay, so mammogram recommendations. You mentioned a little bit, they could be confusing, and we want to kind of sift through that. But just earlier this year, you joined our program to discuss a change in government guidelines. So tell us what those guidelines are.
So
first.
The new guidelines, the American or the Society of Breast Imaging and the American College of Radiology have for a very long time recommended breast cancer screening beginning at age 40, and now the national guidelines have also concurred and agree that all women who are average risk should start screening at age 40, and we continue to recommend patients be screened every year.
Okay. So you can get it at 40.
Absolutely.
And recommend
we
it
should.
at 40.
We want you to start
Always
40.
start at 40. and only sooner if you have a family history.
Well, and not just family history. So please talk with your healthcare provider by age 25. We recommend now that patients talk with their healthcare provider by age 25 to see if you have high risk factors for breast cancer that may require you to start screening earlier and have additional types of screening.
Okay, so this is something that Megan brought up. You said you had heard several women around your age, younger, being diagnosed. I have a friend who has 3 friends who have breast cancer, and it came within 6 months after getting a clear mammogram. Will those recommendations ever change to where it's sooner than a year?
You know, I think right now I don't see our recommendations for screening mammogram being sooner than a year. And But what we do see, patients that present sometimes with cancers in between their screening mammograms, so within a year, it may be because they were high risk or had dense breast tissue. And that's why those are actually the types of situations that have really made us advocate for additional supplementary screening in those high risk groups, such as the dense breast tissue or high risk patients.
All right, so be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a check on our COVID count on this Monday with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Hi.
Hi, good to see you.
Hi, it's good to be back. So yeah, today we have slightly increased number of cases. Obviously, we have seen that the last couple of weeks as far as hospitalized active inpatients. Today we have 22 active inpatients. That's up slightly from 20 last week. 19 the week before, 16 the week before that. So slowly, but luckily it's just slowly, but increasing a little bit, and we'll just kind of continue to track the data and see how many hospitalizations we have.
Okay, you said it's good to be back because you traveled a bit this weekend. Were you seeing masks when you went to another state or on flights? What's kind of what's it like out there?
In the airports and on the flights, there weren't many. You know, it was probably just a couple out of 100, so maybe 1% to 2% out of every 100 people. But you know, that may increase as we get into the colder months. Obviously, it'll probably be those people who feel that they're at highest risk, or those people they want to protect themselves while they're getting to their destination, so they don't get sick on their destination as well.
Okay, any update on vaccine availability?
Not that we have seen, certainly at our health system here. We do expect it probably this week, so that is good news. We still do also understand that, again, those commercial pharmacies may or may not have it. I think there has been problems with the amount available and the rollout in general through the United States. I've heard other areas where people are wanting to get it that they aren't able. So unfortunately, it is rolling out slow, but we do anticipate hopefully within the next couple weeks there'll be much more supply for people to get.
All right, do we have any reporters with us today? Let's get to our community questions. Lynn wants to know, is it worth asking a tech or a nurse what they see during a mammogram? Can they share anything with you?
So the tech performing the exam is not going to be the same person that's interpreting the exam. The radiologist who is trained and experienced in reading mammograms is the person best able to interpret and evaluate a mammogram. So it is not really worth talking to a technologist or putting them under the pressure of feeling like they can provide you information, because they're not able to do that.
Okay, so Terry wants to know, you mentioned you have dense breast. You must have already known that. Did you get a notification? And will someone get a notification every year that they have it?
So I believe my notification came just in my regular report. So the report that said nothing's going on, you're good. But it did flag that I had dense breast, and then it had additional information about other screenings that I could do. They weren't recommended at the time. I don't have a family history of breast cancer, and I was 40 at the time, so still at the bottom end of that screening kind of age limit. So I didn't get anything else done, but I love exactly what you said about we kind of have this baseline now. So when I go back next year to get it done, they're going to be able to tell really easily if, you know, something has changed, which is probably the most important indicator.
Yen wants to know, is there any update treatment approach for triple negative breast cancer in the U.S.?
You know, that would be best answered by the medical oncologists who know a lot more about treating triple negative breast cancer than I do.
Who will be on this, I think, Wednesday or all week.
I would save that question for Wednesday just to make sure they give you the best answer.
You bet, you bet. I do have one that's perfect for you, though. Georgie Ann says, I remember Dr. Wimblad for when I was going through breast cancer treatment 7 years ago. Very thorough, reassuring, and put me at ease when getting a biopsy. So just letting you know that. And Randy wants to know, how does size factor into a mammogram? Can breasts be too big, too small when you're actually in there on the machine?
So we do have different size paddles. So if you have a very small breast, we have paddles that will work to get really good imaging. If you have a very large breast, sometimes we might need to take a few more images, but we are going to be able to get excellent images no matter what your breast size is.
And Janet wants to know, if you do have dense breast tissue, how often should you get screened? Is it still that 1 year?
Correct. So we still recommend that patients who have dense breast tissue have a screening mammogram every year. This remains critically important. There are many cancers that we see only on mammogram, and several of our supplemental tests, such as ultrasound, aren't as helpful without a mammogram to compare to. So we always recommend the screening mammogram, but patients with dense breast tissue should consider at least and talk to their provider about having additional screening every year with abbreviated breast MRI, contrast enhanced mammography, or ultrasound studies.
Joellen has a question, and it is, when can a woman go to every other year? And what about people older, like as they get into their 70s and 80s?
So I recommend patients, no matter what their age, if they're undergoing screening, I recommend screening every year. If patients wait for 2 years, that gives cancer time to grow, especially those high-grade cancers that can really affect patient mortality and morbidity when we don't catch them early. The goal of screening is to find cancer at its smallest size and hopefully earliest stage, and screening every year is the best chance of doing that.
We've talked about how you are you're an expert. You have expert experience when it comes to screening. And Reese wants to know, do you ever look at images of anything else? Are you just inundated with breast tissue and making sure that you're looking for breast cancer?
I am a breast specialist. I look at breast every day, through and through. I want to be the best I can at finding breast cancer and identifying breast disease, both benign and malignant. So I look at breast every day.
Well, and a lot of it, we've shown breast images up on our screens before, but when you see it, every breast looks different, I would imagine. So you see it and you're looking and nothing looks the same, correct?
Every breast looks different. Every breast pattern is different. All the different types of imaging we perform, mammogram, MRI, ultrasound, the breast looks different on all of them. So there's a lot of variety in what I do, even though it's just the breast.
Okay, well, and on that note, Barsha says she has nothing but gratitude and kudos for the expertise of the breast imaging team. They found my sneaky tumor hiding in a tricky place that I couldn't even feel. So where you do get your mammogram matters, as she says. So she just thank you helped save her life. Let's talk about self-breast exams. Necessary? I think it's going to be hard. Is that something that you still recommend? It's hard not to tell women not to do that.
Right.
You don't want to rely on it.
I recommend that women know their bodies, know their breasts. There's no strong recommendation for, we used to talk about self-breast exams in a certain way, and there's really no strong recommendation for that. However, I think anytime a woman notices something different, you notice a new lump, you see a change on your skin, on your nipple, you notice new nipple discharge, alert your healthcare provider, come to breast imaging and get the necessary imaging so that we can make sure nothing's wrong.
How have we moved the needle in making women just feel empowered about their bodies? And because I asked my girlfriend last night, I said, did you feel it in a self-breast exam? I said, do you normally do those? She goes, I do them all the time. She was loud and proud. You bet I do it all the time, So have we come a long way over the decades in letting women feel empowered about knowing their bodies and feeling their bodies and being okay with it?
I think empowered to feel their bodies, empowered to let healthcare providers know when there's a problem, empowered to come get screened and get imaging. So that excites me. I love when women come and tell us their problems and make sure that we can answer their questions and hopefully dispel any fears they have about breast cancer or breast imaging. So.
Nothing's off the table.
Yeah.
So had you had friends, Megan, who had already had theirs? Mm-hmm. Something well discussed at the table?
It was discussed. And it was one of those things where the minute, because I turned 40 and this was like 6 months later when the thing went off and I went, oh, I need to go get my mammogram. My friends were indignant with me that I did not already have that on my to-do list.
Good.
What? You haven't gone yet? Get on there right now. And I actually had a friend, a coworker, who every time I saw her in the hallway, she'd be like, did you schedule it yet? Did you schedule it?
Love it.
So it was positive peer pressure, and I'm all here for it.
Well, absolutely here for it. Yeah.
And we try to make it easier to schedule. Now there's online scheduling. We offer evenings and weekends. I think over the years we've made it easier for women to come in and get screened.
And it's quick. I've always said that. When I just had mine, I don't know, maybe 5 or 6 weeks ago, and I'm like, I love it because I can be in and out in 15 minutes.
Yeah.
It's good, very efficient. Let's talk about men and breast cancer. Again, we have an entire show dedicated to it this Friday, so hang tight for that. When should men get a breast cancer screening? Should they ever, perhaps if they have a family history?
So this is a new and evolving topic, and there actually are groups of men who we now recognize should be getting some regular screening. And these typically are men with a high risk of breast cancer, such as men with a BRCA gene mutation, or men with certain genetic predispositions. So please, men, if you have a strong family history of breast cancer, talk with your providers. they might, ask about family history and identify you as being someone that needs genetic testing or needs to be screened or needs to see one of our high-risk breast cancer providers at KU who see men all the time that are high risk and will be really good about letting patients know if they need to actually undergo screening or regular clinical breast exam.
And thanks for sharing that men are not alone. And Friday we'll talk about that and breaking down that stigma. It's okay. It happens to men as well. I want to get today's takeaway. And Dr. Wimblad, I'll start with you. What's the biggest takeaway for today's talk?
I think for today, we're kicking off October. This is a really important time for us to, tell patients, come get screened. If you are 40 years of age and have not yet had your screening mammogram, please schedule now, schedule online, whenever it's convenient for you. We want you to come in, get that screening. And we as the radiologists want to be able to hopefully find breast cancers when they're small and treatable and when patients will have good outcomes.
All right, Megan, what is the biggest takeaway from your story?
Yeah, I think my biggest takeaway is just to go ahead and get yourself scheduled for your screening. It is not as bad as you think it's going to be. And as somebody who's been through the experience of a child taking care of a parent with cancer, I want to make sure if my children are ever in that position that, like you were saying, it's at the earliest possible stage, the easiest possible treatment, so that they don't have to be put through that as well, and neither does the rest of my family.
Thank you for letting us follow you with a camera back in there. We promise we don't do that to everybody with strict.
I offer.
You did offer. Of course you did, Megan. That's how you roll. I know that. And before we go, we do just want to say another thank you again for letting not only Megan share her first mammogram, because she's not the first woman to let us bring a camera into what is quite an intimate situation, but these women said that they let us come along as well in order to encourage other women to get screened, and we appreciate that so much. So please get screened, and if you want to schedule a mammogram, really easy. Text the word MAMMO, MAMMO, to 913-588-1227. Info is right there on your screen. Text that and get more information about scheduling your mammogram. Thank you again to all of our guests and to our viewers for being with us and asking their questions. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Not every woman wants to share her breast cancer story, but Cynthia Newsom is not every woman. I'm Jessica Lovell. On the next Morning Medical Update, we'll catch up with this Kansas City news anchor and find out how she's doing on a new cancer trial. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.